Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. We are here once again with Dr. Zahra Figueredo. How are you, doctor?
I'm really well, Luis. Thank you so much. How are you doing today?
I'm doing great, as always, and thank you for asking. Doctor, we do have a very interesting topic today since you always say that the importance of personalized treatments, and you always mention it in all your podcasts. So, can you tell us just a little bit about how is your approach for each prospective patient since the first contact and during and after?
Yes, that is a really important question because there are parts of our treatment approach that is standardized, which is how we approach each patient. However, it is very, very individualized and personalized in that first contact, we will talk to the patient, assess his or her needs, expectations, where they're at now, currently, and where they expect to be, and so we start with that. And what we do is we start with a medical intake form, and where we have the patient commit to filling out a medical intake form and submitting it back to us, along with any images and reports and blood work that they may have. And then we do a first contact and first consult with myself. And from there, I do a very, very thorough assessment as to what is required for pre-treatment, post-treatment, and treatment itself, in regards to how we will approach any recommendations, pre-treatment recommendations, in what we will require for the patient regarding diet, lifestyle, key supplements, sleep, psychological, emotional, and spiritual aspects of wellness, and so on and so forth. So each approach is very, very individualized, and we approach it and adapt it in a way that it makes it very, very conducive for the patient to apply it to their life and to their lifestyle. There are patients that can't make a lot of changes, and then there are others that are willing to go great lengths to really make a change. I like to always use the quote, and I paraphrase here, by Einstein. Insanity is expecting a different outcome by doing the same thing. So it's really important for my patients to understand that sometimes when you want great change, you have to make a change. And that can be baby steps. That can mean doing a little bit of this, a little bit of that, without compromising their standards, and not without compromising the treatment itself. And so we adapt and allow the patient to adapt to us, and we sort of meet halfway. And it becomes a really, really important relationship with our patients to be able to do that and to be there for them, and for them to call us up or text us and let us know, hey, Dr. Z, or hey, Lucia, I can't do this. I need help. Or I feel overwhelmed, or whatever the case may be. And so we work very, very personally with our patients in order to overcome those challenges and limitations, and to make this a journey for both of us. And it's a learning curve for both of us, and it's a journey that I always tell my patients that, don't worry, I'll be here to hold your hand. So it becomes very personal to us.
But, doctor, since you mentioned a few guidelines in your previous answer, and you said that you can accompany this patient through the journey, can these guidelines be a little hard for some patients, or can it compromise the outcome of the treatment?
You know, it's not, I think that I don't think it's so difficult in terms of following some of the guidelines, because what we try to do is sometimes there are a lot of recommendations, okay, for the patient, and I specify that, this would be good for you. However, we don't implement everything all at once because it can be overwhelming. And so what we try to do is we try to implement maybe three or four of the most important guidelines and the most important recommendations for that patient, and for what we're trying to accomplish for that patient. And so we'll implement three or four, and then slowly over time add a fifth, and then eventually a sixth. And we try to make it so that we can implement these things without overwhelming the patient, and also without compromising the treatment. And it's a very, very um, easy and way of meeting in the middle and compromising, the two dichotomies of very extreme and not enough. So we meet halfway in the middle, and it creates a happy environment for both, for us to accomplish what we need and the patient to be comfortable. And once the patient starts to see that, hey, you know what, change is happening, and I see a difference, even with the pre-treatment. And that's what motivates them to do better. And that's where we start to create real change.
Doctor, since your approach with the stem cells, of course, is considered a naturopathic medical treatment, um, what would be the difference between you and a traditional Western medicine doctor?
Mm-hmm. I've been trained as a naturopath and as a allopathic, in both, the best of both worlds. And my choice is always drug free. I do use, antibiotics when we need to. We use sedation, of course, during our procedures, conscious sedation. So we do use pharmaceuticals when we need to. Um, my approach as a naturopath is that I approach a patient, not a disease. Okay, I approach patient as a whole, and not just systems and not just symptoms, which tends to be approach of many allopathic and conventional Western medicine. In that, okay, you have these symptoms, let's get rid of those symptoms with this pharmaceutical drug, without really addressing the root cause of the problem. My goal is to address the root cause and fix the root cause of the problem so that the symptoms eventually down the road disappear. And so,
And
and it's
sometimes it can be psychological instead of right, doctor?
absolutely,
Because when you say find the root of the cause, people think that it's always because I went to this place and I ate something, and it might be something psychological. It might be that you were predisposed before you were going to eat that hamburger, especially that special
yeah,
um, that special hamburger. I was trying to say. Um, but you do approach the psychological part, right, doctor,
yes,
as well?
yes. Thank you for mentioning that. It's really important, because yes, a lot of disease, it can be psychosomatic, which means that it's real. However, a lot of times the stress, for instance, I see high stress individuals, type A personalities, that tend to
Trigger.
trigger and manifest organic disease because they may not have processed a trauma, or they just have a really high stress lifestyle, and that cortisol response results in disease of the body. And um, and so that's why it's really important. And Louise, as you know, and I'm going to sound like a broken record here, our wellness is not just our physical body. It's addressing those psychological, the stress. the trauma that we may have had as children or as adults in a, I don't know, in a traumatic relationship or a situation or whatever may be the situation or the cause. But really, really important in addressing these things. And we've also found with the latest research that stem cells can die from cortisol and too much alcohol. Okay, so when we do stem cell treatments and when we approach, when patients approach us and we talk about all these aspects of their well-being, it's really, really important that we give them tools and equip them well in dealing with stress, in dealing with traumas. Perhaps they may require professional therapy. Um, they may, a lot of patients come to us and we have to address alcohol and alcoholism, and a lot of patients don't realize that they may be functional alcoholics, and we do this in a very, very loving, in a very, very approachable way, because we don't expect patients to change overnight. And so we do this in a way that can be very, very conducive for them and we can approach it in a way where they find a happy medium to be able to do and make these changes in baby steps. And also when they start to feel better from these baby steps, again, it motivates them to just do more. And that's what we find with patients. It's not the end all be all. These pre-treatments are not the end all be all. We've had patients that have come to us and said, "Hey, Dr. Z, I don't really want to change these things. I don't want to." And we've had literally alcoholics come to us where I don't want to stop the alcohol, but I want stem cell treatment. And that's their choice, that's their prerogative, and we respect that. And we proceed. And it may take longer to see a change, but we absolutely see a change. Patients that are cleaner, that decide they want to make those changes, we see results sooner, within weeks or months, a couple of months. However, we've seen changes in patients. I'm thinking about two functional alcoholic patients right now in my head that decided, I don't really want to stop drinking. And we didn't see a change, and I mean significant, drastic, positive results after 9 months or a year. So we saw the changes, it just may take longer. So I need to say this to my patients because, yes, ideally, I walk the talk, and I do what I want my patients to do, and that is what I preach. However, I don't expect everyone to be perfect, and I don't expect everyone to make all the changes that we would like them to make. So we work with them, and we make those compromises, and we find ways of, okay, you can't do that, but let's try to do this instead. And we make those happy compromises so that patients get the results they need and they want, without changing their quality of life and the quality of life that they expect, that makes life worth living for them. It's not about what I want for them, it's about what they want. And so it's really, really important that we address that and we make it approachable for our patients.
Doctor, since you gave us those examples, those patients, those type of patients, how did you go about filtering and screening these prospective patients when they contact you?
Mm-hmm. Yes. Okay. So what we do first is we because we have patients from all walks of life, socioeconomic, socioeconomically, um, different types of conditions that they approach us with, whether it's a musculoskeletal injury or an eye condition or an autoimmune condition or erectile dysfunction or aesthetic or anti-aging patient. We have to screen each and every one individually, and we do this by obtaining a medical intake form, and that is their first sort of commitment to us that, okay, they went through, they invested the time, maybe about 10 minutes to complete the form, submit it back to us. with whatever reports and images that they may have, and then a very, very comprehensive blood work screening that consists of the basic hematology and comprehensive metabolic panel, as well as hormones and some certain key cancer markers, as well as we look at some viral titers as well, and we do a screening based on that. And then once we address once the patient is approved in terms of all of their physical and blood work and all aspects of, okay, we can do something good for this patient, that gives us a green light to be able to treat this patient. And once the patient agrees that, okay, this is going to be the treatment approach, this is going to be baseline costs and all the other costs involved, and basically, and once we all agree on this in this process, that's where we address the next step in itineraries and how we're going to schedule. And so once we agree in this process to, in terms of the treatment proposal, all the prices involved, we will do scheduling and itineraries and set up. We take care of everything for the patient except for airfare. So once we get to that point, that would be the next step.
Is there like a well? I know you mentioned before that there is like a 2 month period to get the patient ready before they come, right? What
Yes.
does that entail?
Mm-hmm. So it's 1 to 2 months, depending on the patient, because again, this is so individual. We have many of our patients that come to the Stem Cell Healing Institute. They already know what they're getting into. Okay, and that, what I mean by that is they understand that they're going to have to clean up a little bit. Most of our patients are already, they already walk that down that path where they eat pretty cleanly. They know what's involved with stem cells. They've done the research. They take certain key supplements that I would have already recommended. They do fasting, for instance, and we don't require all patients to do fasting. Sometimes it is recommended, though, for the stem cells and for the patient's condition. But there are these lifestyle factors that a lot of patients have already implemented because that's just the way they do things, and they also know what to expect before they come to us. So if that's the case, maybe just a 1 month pre-treatment sort of pre-treatment cleanup and a pre-treatment journey. For other patients that we may require a little bit more of perhaps a little bit more of a detoxification, a little bit more of a foundation to create that environment in the body for the best possible outcome, that might take a couple months. And so that's where we differ. And that's the key. I think I touched up on something that's really important. The goal is to create, before treatment, is to create this very, very secure and structured foundation and strong foundation to which to build on. And so if we already have that in the body, it makes the job of the stem cells much easier to go even further, to go the length. So that's what we're trying to accomplish in that 1 to 2 month pre-treatment protocol.
I heard you said before patient safety is first and the treatment outcome is second. Would you say this personalized approach is what allows safety and outcome to coexist?
Absolutely. We get both. That's our goal, is we accomplish both very safely, very effectively, safety and outcomes. And we do that because of our very, very careful screening and approval process, and our treatment approach. Sometimes we will do peri-organ or intra-organ injections based on the patient's well-being and what the results that we're trying to accomplish. If we find that it could be too risky for a patient, we will forego that and we'll find another way of accomplishing the same outcomes without putting the patient at risk. And also, part of the pre-treatment also involves building up a really depleted patient. So when we have for instance, an autoimmune patient or let's say a renal patient who's been very, very depleted, part of that pre-treatment will involve building them up and providing key supplements, even certain key nutraceuticals to build up their blood or to build up their nutrient deficiencies and things like that in order to get them, again, get that strong foundation so that we can get the most out of the treatment for them. And so, yes, we ensure that the patient is well enough for treatment and do whatever we can within the safety, the precautionary measures, and take the precautionary measures necessary to do the very, very best and to get the best outcomes. And yes, safety first.
And doctor, this will be my very last question. I know you have this is a longer podcast, but I was wondering if you have ever turned down a patient.
Yes, and that's why we do this very thorough approval process, because we have to see that the patient is safe and well enough to forego the treatment. Even though it is a very, very non-invasive treatment, there are parts that can be invasive enough for a very depleted patient. So if the patient isn't well enough to forego even a sedation, for instance, which isn't very often, we will, unfortunately, they wouldn't be approved. If a patient is not well enough if they have an active cancer, that would be number one. That would be one of the biggest reasons we would disallow a patient from foregoing from going through treatment, would be if they have an active cancer, because stem cells because they were so regenerative, we don't want to give the opportunity to the cancer to gain more strength, which can potentially happen. We've never seen it happen. However, there is the potential for that to occur. So any patient with an active cancer, we have to deny treatment. And we have had patients that have had cancers in the past that are in remission currently, and all of their cancer markers are null. In that case, it's a green light for them. That's not a problem at all. And also patients that have very, very unrealistic expectations. That is another sort of red flag for us, because we have to bring them back to reality and say, hey, you will see results. Maybe not a cure, but we can pretty much guarantee positive outcomes. But perhaps not after one treatment, or perhaps not to the degree that you're expecting. So expect to possibly after a year require further treatment for that condition. Okay, not all the time, but for certain conditions, and depending on the disease, depending on the age, there are a lot of factors that account for whether or not a patient would require more than one treatment and the results that we can expect. So we have to make sure that the patient's expectations are managed as well. So those are the two main important factors to consider in approving or denying a patient.
All right, doctor. Like I always ask you if you have something else to say in this podcast.
I think we've covered a lot of ground. I think that we welcome any questions from our viewers and listeners, which are so important, and we try to address in a timely manner. And yes, I think that would be the best place to end, is just welcoming any inquiries from patients.
Okay, so there you have it. In case you want to ask doctor, in case you have a question for the doctor, please send us an email to info@stemcellhealinginstitute.com. Thank you for listening, and thank you, doctor.
Thank you, Luis. You have a good one.
You too. Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.